NPC and the technology behind the NP screen test. NPC is a type of cancer that grows in the center of the head, often undetected and without noticeable symptoms for long periods of time. The nasopharynx is a region directly behind the nose and above the throat. In certain susceptible individuals, the epithelial cell lining of the nasopharynx can get infected by the Epstein-Barr virus, also called EBV, which, along with other factors, triggers normal cells to turn into cancer cells. The virus passes through the cell membrane and enters the cell's nucleus. Then it combines its viral genetic material with the patient's epithelial cell DNA. The virus triggers the cells to become cancerous. The cells multiply, and the cancerous genetic defect is passed on to subsequent generations of cells. The tumor grows within the space of the nasopharynx and can migrate or impact bone, nerves, and other delicate structures nearby. Sometimes it grows submucosally, underneath the surface, making it very difficult to observe, even by a trained physician. An accurate, simple, and non-invasive early-stage detection test for this cancer is available. It is called NP Screen. This test can detect cancer at stage 0. It can also detect cancer that can't be seen with the human eye. The test uses a specially designed brush, which is used to easily access the nasopharynx through the patient's open mouth. The tip of the brush has a soft, mildly abrasive surface that is used to collect cells. The physician has the patient relax and open their mouth. The physician then inserts the sampling brush over the tongue, behind the uvula, and up into the nasopharynx. Once in the area, the brush is rotated and used to collect a direct sample of cells from the epithelial surface. During the collection process, the brush slides gently across the surface of the nasopharynx. This act of brushing the surface ensures that a substantial number of cells come off from the epithelial lining and are caught by the brush tip. In the majority of cases, all of the cells are normal. However, in certain circumstances, the sampling procedure will pick up cells that have been infected by EBV. It will even pick up cells from submucosal tumors that lie beneath the surface and are almost invisible to normal endoscopic examination. The brush is then removed from the patient's mouth and the collection tip is cut off and placed in a vial of preservative, which maintains the integrity of the DNA sample for long periods of time at room temperature. The sample is then placed in a FedEx clinical pack and sent directly to our lab in North America for analysis. In the lab, the cell sample is spun down and separated into a number of different components. The segments are tagged with a radioisotope and amplified through the PCR process. This allows even very small amounts of EBV to be detected in epithelial cells. The results are plotted on a graph against time in order to clearly differentiate the normal and infected states. The results are then analyzed, and a secure, personalized medical report is sent to the patient's physician. A report that is negative for NPC means that the patient does not have the disease. A positive report means that the patient has NPC and needs to see their doctor for confirmation and treatment planning. This advanced technology genetic test provides the most accurate method for early detection of NPC and ensures better survival and fewer side effects for patients.